Hello, everybody. This is Rex Stroud. I'm the program director for the Indiana University School of Medicine Memorial Hospital Jasper Family Medicine Residency Program. If you can say that complete line without taking a breath, you probably don't have COVID-19. Little joke, little humor today, just to kind of break the mood a little bit, just because of the fact that we know we're under a lot of stress right now with everything. And this is the distraction that I promised you guys yesterday. It's time to celebrate a little bit and welcome our new residents that are coming on board. Exciting times to bring these people into the fold and our new family members that are coming on board. So a little bit before we get to the big reveal. This is a quote that I felt was very appropriate at times like this. This is a quote from a leader who knew a little bit about leading a country through times of disaster, through tumultuous times, fear, those kind of things. One of our allies in World War II, healthy citizens are the greatest asset a country can have. And with that being said, I think that this is very appropriate for this kind of time. Just not only a positive thing to basically keep our eye on the ball, so to speak, and again, a very good way to think about things. So this is from Winston Churchill. Again, someone who knew a lot about leading a nation through difficult times. So the other thing too, I can't go into all this without thanking a few people because of, again, all the current things that we have going on. And I think it's very appropriate that we thank some people. First of all, for Indiana University School of Medicine and their leadership through all of this. Things are changing so rapidly for everyone. They're staying on top of the ball and making sure that we're keeping residents safe, yet at the same time protecting their training and getting those patients seen. And then also for Memorial Hospital, just the thankfulness that we have that we're all on the same team and we're all working together to deal with all these problems that we have right now. And that we have great leadership. I mean, the administration has stepped up. And to be able to change the way we think about things. This has affected everybody's lives. In addition to that, I mean, when we think about people like infection control, and I'm going to throw in some lightheartedness here, those are usually people we run away from when things are normal. But these are the times where we look to those people for leadership, and they've been doing a great job with talking to the Indiana State Department of Health, giving us updates, keeping us safe. Our chief medical officer has done the same thing along those lines. So we greatly appreciate everything they're doing. The other thing, too, is it's the whole organization. And I'm going to miss people and things of that nature. But, I mean, I think about the surgery department and what the sacrifices that they're having to make right now and changing horses on what they have to do. It takes a lot of courage to do that and a lot of sacrifice. And we appreciate everything that they're doing as far as changing what they're doing. Again, another thing that I want to do is actually thank those patients and those people in the public that are doing the right thing with the social distancing, hand washing, things of that nature, staying at home. It's one of those things where I saw something on the news the other day where it says, with healthcare professionals, we go to work, you stay home. It's one of those things where we'll stay on the watch and we'll take care of those who are sick. You help us by staying home and doing the social distancing. Another thing too, please don't hoard. That's another thing that we always like to throw out there as well. Everybody needs toilet paper. So. Next slide. So real quick rundown here. We've had 757 applicants to our program. And with that, we had 88 candidates that we interviewed. And then also within the organization, we had 48 people that participated in the interview process. And how the match works, I won't bore you by reading all of this. I understand that you'll be able to go back and look at this, but this is just kind of a little bit about the match and how that works and the algorithm that goes into that process. So we'll skip ahead. And then the rules. I always like to throw this up there because a lot of times people want to know, well, how did the rank go? Where did you rank this person or that person? I always tell people I will take that to my grave kind of thing. It's a confidential process. And what I tell everybody is the people we have are the people we rank number one across the board. And it's one of those things that we welcome them all. So this is important, especially at times like this. This is what we look for. We didn't and this is something that I would tell every candidate as they come through. We didn't want residents who think being a physician is about glory, power, or wealth. We want residents who went into medicine to help people with an altruistic heart, more than ever now. We want people who understand that medicine is mission work and it's not meant for everyone. And we want people who willfully choose a career of lifelong public service. Again, those things really ring true right now. So, without any further ado, and these are in alphabetical order, we'll go ahead and get started to welcome these great new residents that we're already very proud of. So, here we go. First one, Rizwan Atik. It's coming to us from Ontario and Saba University School of Medicine. Welcome him aboard. Very excited to have him. Next, Asta Bardwaj from St. George's University, also from Ontario. Very excited to have her as well. Then Eddie Gasho, and he is from St. George's University. He is from Ontario as well, and excited to have him as well. And we also have Cassie Robertson, fellow Hoosier, coming to us from Lincoln Memorial University. So very excited to have her. And then lastly, but not least, Tanya Sajarian. She's coming to us from American University of Antigua, also from Ontario. So those are our 5 new residents that we are welcoming into the fold. Very exciting times. And again, very proud of those guys. And congratulations to each one of them. Really fun thing. Our 5 current residents now have 5 new siblings that will be joining us hopefully in July. And very excited about that. So those are the 5. We'll go ahead to the next slide. In conclusion here, again, very exciting times. And with that being said, last thing to kind of brush up with here is the fact that these guys are coming in at a time that is, again, kind of uncertain and a lot of fear and those kind of things. Keep in mind that these are the people that are going to be standing with us shoulder to shoulder as our life changes and as we combat this virus, and then all the other things that we have to do as well. A lot of times we only focus on the virus, and it's all about the whole thing, the whole patient, and taking care of those problems. And we want to welcome those guys, and we'll take them under our wing, and we'll show them what needs to be done and teach them the ropes. It's definitely an exciting time. Again, we train physicians here, and for us at Memorial to have that opportunity, this is our opportunity to shine. I mean, we train soldiers to go into combat. We train firemen to be able to fight fires and deal with disasters. We train law enforcement and EMS to respond to things like active shooters and things of that nature, because when that call goes out, they have to respond. And for all of us healthcare professionals, physicians, and all alike, and for our 5 new young residents that are coming in, this is our time to shine. We are the ones responding on this one. So we're used to in healthcare, sometimes we feel like we're out of control and people are kind of shoving us around. This is our time, the spotlight's on us. Step up, do the right thing, and remember, be safe, be smart, and remember what we do here at Memorial. We're all about being for others. And this is not that we never practice that, we practice that all the time, but especially right now, keep in mind, what we do is about being for others. Thank you.